Eunice, Mercy, and Damaris are from different parts of the country and live in different circumstances. But they all have something in common. They are Kenyans living with HIV and living healthy and vibrant lives. But it wasn't always like this. 15 years ago, HIV was ravaging the world, especially the African continent. AIDS was considered a death sentence, and in many communities was seen as a curse.
Some, of course, were very sick and down, and they died. And those who died because they were very, very ill, we were losing many, many patients. In a week, we would lose 7, 8, 9, or 10.
AIDS deaths in Kenya were climbing at an alarming rate. In response, the United States created the largest ever initiative to combat a single disease with the aim of saving lives: the U.S. President's Emergency Plan for AIDS Relief, also known as PEPFAR.
PEPFAR has changed the course of the HIV epidemic in Kenya. In the last 15 years, the United States government and the American people, through PEPFAR, have invested 650 billion shillings in combating HIV and AIDS and saving lives in Kenya. Today, over 1 million Kenyans are on life-saving antiretroviral treatment, living longer, healthier, and more productive lives. They're able to take care of their families and themselves. Because of our partnerships with the government of Kenya, healthcare providers, other critical organizations, and each of you, Kenya is making good progress in the effort to defeat HIV and AIDS.
President George Bush understood the need to actually look at HIV as a global health problem and not strictly from the perspective of the United States.
HIV/AIDS is more than just a disease. It touches all segments of life and society. In its wake, HIV disintegrated families and communities, exacerbated poverty, and threatened the country's development. We had to have a comprehensive approach to address HIV/AIDS, and we went to the hardest to reach areas. To save lives, treatment was critical. Before PEPFAR, treatment was not accessible to most Kenyans. When PEPFAR began, less than 8,000 Kenyans were on HIV treatment. Today, over 1 million Kenyans are accessing treatment, and this number is increasing every day. PEPFAR strengthened the supply of this life-saving medicine by partnering with Kenyan institutions to ensure treatment was available for all. It was also critical that Kenyans knew their HIV status. HIV testing and counseling became available for free to all. Testing also helped mothers prevent passing HIV to their children. At the front lines, providing these services are health workers. PEPFAR invested in training health workers across the country to provide comprehensive care to their patients. Training was accompanied by improvements in the way health facilities collected and stored health information of their patients to have a clearer picture of the HIV epidemic. To keep services in line with the latest science and to provide quality care to Kenyans, PEPFAR invested in research, improving and building modern laboratories across the country. PEPFAR, working with the government of Kenya, continues to plan and implement policies geared towards the easing of the HIV burden in the country.
Mara ya kwanza kupimwa, nikaelezwa, so vile nilielezwa sikuamini. Tena nikarudi tena siku ya pili, ndio nikasema tu vile imekuwa hivyo, sio mwisho wa maisha, ndio nikaanza kumeza madawa.
The first thing I asked the counselor was, nitakufa. So I went home for like 2 weeks. I didn't talk to anyone. The journey has not also been easy. Ups and downs, up and down.
Ngoja nikamuelezea mother, mimi pia na wakati huo ujue mimi bado ni addict to a drug. Ni ngumu kuhandle kunywa methadone na kumeza ile.
Kusa nikakuja nikachukua twins wangu tena wakapima, wakakuwa wazuri. Mpaka saizi watoto wako wazuri.
I didn't let my status put me down. So what I would say to other adolescents and youths out there is be happy. Because your status will not determine who you're going to be. Just be yourself, live your life, enjoy your life, and have fun.
Kama hizi dawa za methadone na hii ingine ya CC ambayo natumia ingekuwa hakuna, ingekuwa dunia imeisha hii. Lakini ni muhimu sana mtu kuangalia status yake, ndio ujue unaelekea wapi next from hapo. Kama hauna ujue sasa utajikinga vipi isikupate.
Mimi na meza safari moja jioni na asubuhi. Kama ingekuwa inauzwa singeweza kununua kwa sababu ya hali ya pesa hakuna. Tunashukuru kwa mzungu kwa sababu alikubali akatupea free.
Silipi, pali nyingi silipi, hiyo ndio kitu imenisaidia sana, lakini ningekuwa ni mali ya ningekuwa nimeshindwa, ningekuwa hakuna.
The ARV treatment is easily accessible. It's just simple. Kunywa dawa yako, because I say my drugs are my best friends. Actually, they are my first love. So when you treat them better, they'll treat you very perfectly or well.
There are countless stories like these across the country. Today, more Kenyans with HIV than ever before are living healthy and productive lives and contributing to the development of their country.
In the years ahead, the United States looks forward to continuing to support Kenya in its effort to build a stronger healthcare system that meets the needs of all of its citizens on HIV and AIDS and other health challenges.
A future without HIV is in sight.